Well, that's the sign that we did that right. Excuse me. Oh gosh, why don't we get started? So it's a treat to be with you all today. I'm gonna shush and get you over to the reason you're online. Just a few housekeeping or things to keep in mind. You know, fireside chat. The key word here is chat. Bonnie's got some things to share. There's some neat things going on at Lincoln Memorial, but it's an opportunity to talk. Whether or not about the program. I'm sure Bonnie would probably go in 32 different directions and talk about just about anything that matters to this community, knowing her, and we'll go from there. But in case you don't know Bonnie, as the clicks pick up from me here, she is the director of the Masters in Veterinary Care, Clinical Care at LMU. But as you're reading her bio, the things that stand out: undergraduate work in anthropology and biochemistry, primate fieldwork, conservation studies, and not over here in some piece of the contiguous 48. We're talking Central America and West Africa. So we got some neat stuff going on, and a career that's touched a lot of different places, and now is doing some real neat work to not only take care of animals and whatnot today, but to craft a new generation of folks doing that in the future. She's also on Pride BMC's mentorship working group, which ties so much back to the educational space, DEI working group, and all of these things. And she's from the University of Tennessee, the Vols, I do believe. But every friend you have something you don't hold against them that much. So Bonnie, it's a treat. It's a thrill. Thanks for doing this. It's time for me to shush and get it out of your way.
Thank you, Todd. Well, it's really nice to see so many people, and I'll do a quick overview of what we're doing at LMU, and then I really do want to have a chat with everyone. So, like Todd said, my name is Bonnie. I'm at Lincoln Memorial University. I'm a veterinarian. I graduated from the University of Tennessee, Knoxville, with my DVM and my MPH. I worked in private practice for a few years, which was never my goal. My goal was to do public health work, but I graduated around the recession. And so there was kind of a freeze in the government and a freeze in public health spaces. So I ended up working in a practice in Florida. And then after a few years of doing that, what I found I loved the most was working with the tech students that were coming through on their externships and the pre-vet students that were getting their kind of shadowing experience. So I started looking for jobs in education. So that's how I wound up at Lincoln Memorial University. I was hired to help them establish and start a pre-vet program. So they had just envisioned the vet school here, and they were starting to think about accepting folks, and they wanted a little bit of like a undergraduate feeder program to produce some potential applicants for their vet program. So I started here and started that pre-vet program, and then after a few years became the department chair for veterinary health science and technology. So I oversaw the pre-vet programs and the vet tech programs at LMU as undergrad. And I did that for a number of years. I loved it. And then this last spring in February, I was brought over to the vet school to be the director of this new master's program. So that's what I'm here to talk to you guys about today. So the brief history of this master's program is that several years ago, some folks that were a part of this Veterinary Innovation Council were brainstorming ways that we could, as a veterinary profession, overcome these upcoming veterinary shortage problems that were being predicted. So they were thinking, how can we do this? How can we create kind of a more empowered veterinary workforce? And so they started thinking about creating an area in veterinary medicine for a potential mid-level provider. So that's the origin of this. That's not where we are now. So it has evolved over time into a degree program that is designed specifically as a master's program for credentialed veterinary technicians. So this would be the first master's program in the country for credentialed veterinary technicians, designed to build on what we teach them in their accredited veterinary technology program. So I'm really, really excited about this. I think it could be a wonderful education ladder for technicians and a career ladder for technicians. So what I want to do now is share my screen and show you the curriculum that we have in place. Give me just a second, and then we can talk a little bit about admissions requirements and kind of where we see this going. And then I'll stop talking, and then I want to hear from you guys. So so this is the curriculum. We're starting this fall. I'll show you in a second. We've got 25 students starting, all credentialed veterinary technicians from around the country. So this program is fully online, and it is completely asynchronous. So students can access the material at their own pace. Every single one of the students that we have starting this fall is a working professional, many of them with years up to some of them decades of experience in the field. So we have a 30 credit hour program, and that's what I was kind of inherited. You know, I kind of acquired that, had already been firmly established when they sought accreditation for the program with our regional accrediting body. So I had 30 credit hours to work with. And so what I've built is a master's program that has a core set of kind of curricular requirements that everyone gets, and then opportunities to concentrate or specialize with electives. And over time, these electives will kind of evolve as we see what the needs are of the students. But the core curriculum is this fall. We'll start with a veterinary management and leadership course, clinical physiology, principles of surgery and wound management, evidence-based medicine. In the spring, students will start to be able to take electives, but everyone's taking anesthesia and pain management, population medicine and One Health, and then a basic pharmacology course that is going to go into more depth on just kind of principles of pharmacology, so pharmacogenetics, dynamics, distribution, elimination. The last semester, students are going to take advanced patient management and communication, so that's kind of the capstone course. So that'll be really case-based and kind of working through complicated patient management cases, as well as maybe complicated communications cases, clinical pathology course, and then room for a couple more electives. So this is our basic curriculum for the small animal concentration. Our plan is over the next few years to kind of add in different concentrations. So there is some interest in a shelter medicine concentration. And then we'd really like to start looking at like mixed animal or rural practice, large animal kind of things. But I think that I want to give a couple more years because I want to get that really right. So this is our basic curriculum. What we're going to do, so these courses are going to be co-taught, the majority of, you know, principles of surgery, wound management, anesthesia, pain management, these elective courses are going to be co-taught with veterinarians from LMU's College of Veterinary Medicine and veterinary technicians. So it's our goal to get a VTS in each of those courses to help co-teach that course. So this fall, we've got, who I see on the call, Terry Kleist is gonna be, she's a VTS in surgery, so she's gonna be co-teaching this course with our veterinarians in the fall. So we're gonna have an anesthesia VTS, we're gonna have, you know, emergency critical care. So we're gonna get technicians in these courses. We're having to be creative with that because I'm guessing many of you are in vet tech education, and we have this issue, especially at LMU, where we're a level 6 school with the kinds of people that we can hire as faculty. So I'm playing around and bringing people in as clinical instructors or lab facilitators, or, you know, however I can get people into the courses. That's what I'm doing, but it's important for me to get a VTS in as many of these courses as we can for our students. That's our curriculum. Our thought is over time, in addition to those additional like shelter medicine, large animal concentrations, we really want to align the curriculum with the VTS academies. So, you know, obviously it would be a lot for us to have a way to prepare students for all 16 academies. But, you know, my hope is that if this is successful, you know, other schools can start similar master's programs and we can kind of coordinate and say, look, we'll focus on producing, students that are going to be really great at surgery and could potentially pass that VTS exam, and kind of coordinate. I've been, over the summer, I've been meeting with a lot of people in tech education, but also folks from the UK and veterinary nursing education. And I was really excited to see that they have done something similar in the UK. So they've recently started graduate certificate programs and degrees for their veterinary nurses. And they are doing exactly this, and it's working really well. So each of those graduate programs, basically the student selects their focus, and the certificates that they have also really align with the VTSs that we already have established in the States. So admissions for the program, I mentioned this is for credentialed veterinary technicians. So we've got to have proof of credentialing is a requirement. We understand more than anyone, you guys get it too, that the education, licensure, credentialing landscape in the US is patchwork, right? And so something that's important for me in this program is I don't want to create a lot of barriers, right? I want this to be as accessible as possible, but it's important for me to elevate the importance of credentialed veterinary technicians in our profession. So the credentialing is, black and white, yes or no. You have to have that credentialing. Have a preference for graduates from CVTA accredited programs just because I have based the curriculum on what I know they're getting in those programs. But we do understand that there are credentialed technicians that haven't gone through CVTA accredited programs. So we're looking at those on a case-by-case basis. And if we feel like they can succeed in the program, we're absolutely going to take them. We don't want to keep anyone out if they want to do it and we feel they'll be successful. In addition to that, they need to have a bachelor's degree. So that's just kind of a accreditation requirement for us to offer a master's program. You've got to have a bachelor's degree. But I'm not being too specific on that. Bachelor's of Arts, Bachelor's of Science, Bachelor's of Applied Science. I will take any of those. It just needs to be a bachelor's degree. And then a few prerequisite courses, just so we know everyone's ready for some of the things we're going to be teaching. So 6 hours Gen Bio or higher. But I will sub anatomy and physiology because I think that the science, the biology I need them to know they can get from anatomy and physiology in a vet tech program. Same thing with the 6 hours of general chemistry. I think that what I need them to know chemistry for, they can get from their pharmacology courses. And then 3 credit hours of English. So these are our admissions requirements. We're going to be implementing, so we kind of played with this year in our admission cycle. I'm going to run some numbers and see how it works out. And then for our next full cycle, we're going to implement this holistic admissions kind of procedure. So something as I started reviewing the applications that I noticed is that we had kind of a group of people that had maybe graduated within the last year or two, had 4.0, really stellar students, maybe a year's of experience in a clinic. And then we had students or people applying that were out for 15 or 20 years, tons of experience, involved in their local leadership, maybe have written articles or presented at local CEs, head technicians in their practice. Looking back at their transcripts 20 years ago, maybe not the best student. I wanted both of those, right? I didn't just want 4.0s. I wanted people with a lot of experience and kind of the maturity to do well in this program. So what we wanted to do was create kind of an admission scoring system to get us in, but I wanted to equally weigh academics with experience. So we've kind of set up this pathway and we're going to test it out this year and see how it works with the people that applied last year and kind of see where they all fall. But we put a lot of research into this and I'm excited, and I think it's going to be a good way to ensure that we're not only looking at academic performance to admit students. So the things that we're going to be looking at as we look at applications, their licensure and their educational pathway, the academic metrics. So that's going to be things like GPA and their major program, or their vet tech courses, GPA in their science electives. There will be opportunities if they have a lower GPA to kind of fill out what we're calling an adversity essay and explain life circumstances that might have, caused that GPA to be lower, especially if it was, 15 years ago. Experiences, and we have lots of different things under experience that we're going to weigh and consider. Leadership and community service. I think it's really important once we get to the master's level in education that we accept leaders and produce leaders. We're going to be looking at diversity metrics and then personal statements and letters of reference. So this will be implemented in our next cycle. So this year we used the post-bac cast. So this is like if you've had students or if you had experience with this applying to vet school, if you're a vet, the VIMCAS. So it's similar to that, except it's for graduate programs. So we're using that for our application cycles. So we had, for this cycle, we had 44 total applicants. And we accepted 26. So we have 25 who have confirmed that they'll be here in a few weeks online. And then we have one who we're waiting to hear back from, but I think we'll hear back from her. So potentially we're going to have 26 students starting the program this fall, which I'm really excited about. And these are, like I mentioned, these are pretty impressive technicians. So I'm really excited to see kind of what we do in class and where they take this in the future. That's all I've got for updates. I'm going to stop sharing and then we can chat. Let's see if I can figure out how to stop share. There we go. Stop share.
You have successfully stopped sharing. Anybody have any questions? Anything that comes to mind as you hear what Bonnie is sharing? This is a great opportunity to just dive in. The water's warm. You don't need to raise your hand or anything. We're not that kind of a crowd. But maybe I'm gonna a few thoughts here, Bonnie, if you don't mind me taking a look into this. You talked, one of the things that stood out to me, and it might be my own biases in the affirmative towards what you were saying, was master's programs need to produce leaders.
Yes.
Tell me about what leadership looks like coming out of your program, coming out of a master's program. What are the characteristics you believe leaders in our field should have?
Yeah, so I'll answer that, and then I see a hand up. So this was something that was important to me because I did a dual DVM and MPH. And I remember in my DVM program, everyone saying, you're going to be a leader, you're going to be a leader, you're going to be a leader. And then nobody explained to me what that meant, right? Like, what does that actually mean? Fortunately, I was doing my MPH at the same time. And I was hearing from them, you're going to be a leader, you're going to be a leader. Here's what that means, and here's how you can do that. So they were actually giving us real steps, right? Like, we want you to be able to work with diverse populations. We're going to teach you how to do that. We want you to be able to lead, lead a discussion like this, Todd, right? Like, how do you actually practically, what are the steps to create an advisory board, or, kind of all these things. So we're looking at actual leadership skills, like dealing with difficult communications, managing people, managing teams, leveraging the diversity on your team, like tangible leadership skills that we want to teach them, as well as information about the profession that's going to help them critically think about ways to solve the problems that that we all talk about, right? So with the AVTE, we're always talking about these problems in veterinary technology education. I want to make sure they know what the real landscape is of veterinary technology education, licensure, credentialing, scope of practice, all of these things throughout the country, so they can start thinking of themselves about solutions to that problem. So bringing as many people into that conversation as possible. So that's kind of a little bit of an idea of what we're going to be doing. We're going to be building that into many of those courses, but those practical leadership skills into 3 of those core courses. So that leadership and management course, population medicine and One Health, and then that capstone course. We're really going to make an effort to do that. So this fall, in our management and leadership course, you know, we're going to be having conversations with individuals from other parahealth professionals within the course. We're going to be bringing in folks. We're going to basically be creating a DEI certificate program within the course for the students. So that's kind of an example of some things we're going to be doing. We're going to be doing personal leadership, kind of, you know, these like, sorry, I'm getting over COVID. So sometimes my brain stops working, but we're going to be doing things like Clifton strength tests. Like, what are your own personal strengths? How can you leverage your strengths as a leader? So I don't know if that answers your question. Oh, you're muted.
Yeah, it does no good when you're muted. You know, I think it absolutely does. It was a piece of what you said that I wanted to unpack a little bit. Thanks to everybody who's putting some questions and thoughts in the chat. We'll get to those in a minute. You can keep doing that. You can raise a hand. You can turn on your camera and tell me to shush. You want to talk, whatever works best for you. But Oretta, please dive in.
Hi, good morning. Hope everyone's doing well. A couple of questions. With the master's program, is there a component of this that has to be done as a hands-on or experiential learning portion? And also, I am currently the program coordinator for a master's in public health here at Fort Valley State. And so I'm curious as to what the capstone requirements are in terms of either a thesis or field experience, that sort of thing. And then, of course, about the hands-on, if you have to have that.
So hands-on, right now in the courses we've developed, no. Potentially in the electives in the future, but you know, again, like being accessible is really important to me. So we're not going to do anything that you couldn't do at a small private practice. And if you're not working at a private practice, we are not going to do anything that we couldn't send you models to do these things on. So I will literally, if I need them to demonstrate something and they can't do it in practice, I will pack a model in a bag and mail it to them and let them do it and record it and send it back. So I want it to be super exciting. I mean, that is so important to me because I talk to so many people, you know, I just don't want to put up barriers. I just want to make this easy and get as many people that want to be involved in it.
Mm-hmm. Okay.
And I'll be 100% honest, so we haven't fully worked out that capstone piece yet, but I got 2 semesters, so I'll let you know. I feel like I can safely say that right among educators because we all kind of know how this goes.
Well, as somebody that I'm a licensed tech myself. I worked for many years in the academic side of things, and this just sounds fabulous. And I don't know, at 59 years of age, I'm on the fence about it, but I'm really leaning towards maybe, hopefully, you know, applying for your next.
Oh my God, I would love that. I would love that. Let me tell you, because I've got this, I'm so excited about this class because, you know, I was curious to see who would apply. We have, you know, I was expecting general small animal practice. We definitely have that. We have some mixed animal practice. We've got some folks in rural areas. We've got people who work in vet tech programs, educators. We've got techs who work at colleges of veterinary medicine. You know, it is a diverse group of people. And I think that is going to make the in-class discussions really fun. And there's going to be a lot of peer learning. So that's important for me. You know, that's kind of part of that diversity that we look at when we want to bring it in is I want so many different professional perspectives, like in a single class, because I think that's when we're really going to start to learn a lot.
Well, I think part of me would love to be able to go through this process, and then because we do have several master's programs here on our campus, we have animal science, biotech, public health. Then we have over in education areas, you know, they have their own set, but we have a 4-year veterinary technology program here, and I'm looking at your curriculum and thinking this would be so easy to set up if we had the manpower to, you know, obviously the faculty to man it. And it would be a shoe-in for those that were already here as 4-year vet tech students, stay another 2 years and get your master's and keep moving, you know. So I applaud what you've done because I know that it's a lot of work. I've been there and I've done the same thing with our MPH program, and my hat's off to you, and don't be surprised if you don't see my name in the application somewhere down the road.
Okay, I'll keep an eye out. Perfect.
So there's a related question from Denise. Do you need to currently be working in practice to successfully complete coursework? Words are coming off a little fragmented to me today.
No, you don't. And I'll also say, so, we talked about those admissions requirements. Those are the admissions requirements. You don't need to be working to do this. You also do not need to do this full time. So if you are working full time, you can take 6 credit hours a semester, right? So I think it's about an even split this fall. I think I've got 13 students that are going to take those courses exactly as I showed you, and then about 12 that are going to take part-time with their work schedule. So it'll take them a little bit longer, but again, I want to be really flexible and accessible.
For those who met the prereqs, but may have met them a while ago, not in the last couple of years, you don't care. You're looking at the person.
Yes, I don't care.
Looking at the
person. I need to check some boxes for. So I'm pretty blunt. I need to check boxes for my accreditor, right? But I know that what's going to make this student successful is that they are a driven veterinary technician, so I don't care that you took biology 20 years ago and got a C in it. If that answers your question.
Yeah, I think it's spot on. So does this potentially lead to tech practitioners?
So, so potential. So this is not designed as that. However, there is a lot of interest in that. And that was kind of the origin, right, of how this program came into being, was they were thinking, could we have a practitioner? So we're not designing that because there are no laws to support, or there's no practice acts to support a technician practitioner. In the future, if there are, I think this could be the kind of degree program that could transition into the educational piece of that. So that would be, looking at the way politics and veterinary boards and all these things work, 5 or 10 years down the road. So in the immediate future, no. So what this is designed to do is provide kind of that next level of education for credentialed technicians.
Sure. I've got 2 more, and I'm going to ask my questions, Bonnie. We're going to see if anybody else dives in. And if they do, okay, we're going there. If they don't, we're going to say happy Wednesday, and we're grateful for you. So you built a program here. What was the biggest surprise in building the program to you?
So that's a good question. So let me see. So I'll tell you guys this. So I told you that I built the undergraduate pre-vet program here. I also developed the Masters of Public Health that is not yet started at LMU, but they just received accreditation for. So I've done curriculum design and program development before. You know what, honestly, the biggest surprise for me was with this is that I learned some new, I thought, having been in vet tech education for close to a decade, I thought I knew the landscape of technology, education, and licensing, and all these things. I learned some new things about education and about credentialing in the US. I also have learned that a lot of technicians do not really understand the difference between associate's degrees and bachelor's degrees and CVT and RVT and LVT. And that surprised me. And so when I learned that, I went back to that leadership course we were talking about, and I built in the first 2 weeks of that course are landscape of veterinary technology in the US. Here's how you're educated. Here's how you're credentialed. Here's how you're, that kind of thing. Sure. So that we all really understand that, because I think until, we as a profession, all veterinary professionals can understand that, we're not going to really be able to untangle all that and move forward. But I think as soon as people see like what a mess that is, then they're going to be like, oh, we got to fix this, but getting that out. So I think those were kind of my biggest surprises.
Some of us on the line may find ourselves in your shoes one day, building an undergrad, building a grad, whatever. Is there one tip you'd give them? One lesson you've learned doing this
No.
that you're willing to share on tape?
I mean, no, like, I guess I can't think of one thing that's gonna unlock it.
Well,
Tell
it
you
might be
what,
one thing that unlocks, but it might be one thing that prevents a triple root canal that nobody needs to go through that you have. Save
yeah,
us from the pain.
I think the things that have helped me as that I've learned kind of having done this over several iterations is really being able to sit down and picture, okay, if I'm a student starting here, what are going to be the hiccups? I mean, so sometimes it's little funny things like, oh, I can't offer this course this semester. I've got to offer it in the fall because it'll, like, you know what I mean? But like really sitting down and kind of going through it to see how those
Walk the
little
walk in your head.
fit together.
Yeah, sure.
And thinking out that I think has been the biggest thing, because I think the first program I put together, I ran across that a few times. And so I had to do some revisions, and I kind of created a little bit more work for myself the first couple of years, having to do some cross listing,
Sure.
or, you know, that kind of thing.
Totally good.
So I think that is really helpful. And then, I mean, honestly, like, I love curriculum development. So if anyone ever is in this position, shoot me an email and I'll look over it with you.
How about folks who maybe didn't get the bachelor's, but they've, if you were to go back to their line of experience, you might be able to make the case that their experience is there in lieu of the bachelor's. Is there a pathway?
So right now, no. And it's not because we don't want there to be one. It's because of the education requirements of our accrediting body. So the SAC-COC is what the Southern Association of Colleges is who accredits us. And so that is that's who requires that for a master's program. And this is something I'll kind of look at depending on the applicants that we receive and kind of the conversations I have with the community over the next few years. If I feel like those people could be successful and there's a way we can make it work, I will try to make that work. Again, I'm all about removing barriers. I want people to be able to do this if they can. So I don't know, we'll look and see, but right now there's not. So that, unfortunately, that kind of bums me, because there's so many great techs that don't have a bachelor's that I want to do the thing,
Yeah, it's almost like, how do you get the ability to get them so close to their bachelor's that you can tick that down with just a few classes and get in catapult them into the master's fast. But my sense is, knowing you and just listening to you speak on this topic, the name of the game is to call you or email and just chat, because who knows where it might go.
Yeah, I'm really like, feel free. I love it. If you think of anything, just let me know.
All right, last question, and then we will go. But if I don't make a reminder that it's about 16 days and we'll be in Philadelphia for the annual. So if you haven't registered yet, there's still time. There's still a way. We have virtual, we have in person, we have over 300 friends together for 3 days. It's going to be a good time and a party. And if you do this, I tend to give away a lot of things over it. So you may walk out with a lifetime membership. We gave away 15 of those last year.
Oh, I got those.
Yeah, there you go. The best part is, I don't know who. Somebody is there with a notepad, because I don't remember what I give away and who got it. What's the one thing that you're doing in this program that's unique, or something that you hope carries forward down the line into other people's programs, and it's just the way it ought to be? Is it the leadership development? Is it just to have more Bonnies? Whatever you think.
No. So two things. The leadership development I am really proud of. The other thing that I am really proud of is that I have personally, so I don't know where you guys work, but I work at a 4-year, a Division 6 institution. We are not able to hire technicians as faculty because the terminal degree in veterinary technology is a bachelor's. If we had a technician who had went on and got a PhD in something, or potentially even a master's, if it was really focused, we could hire that person for the undergraduate level as a faculty member. But it's a very big barrier for us. And it has always frustrated me when I was department chair that I could not hire technicians to teach technicians. So starting this master's program, I knew that I wanted technicians to teach technicians. And so I am really proud of kind of how we have gotten creative with how we're going to do that. And so I'm also really proud that we're going to be having specialist technicians, in these courses, really teaching high level veterinary technology to these students. So I think that is something I'm really proud of. So leadership, text, teaching text. Then the last thing I'm really proud of that I haven't had a chance to mention, but is that I've put together an advisory board for this program. And that advisory board is primarily technicians. So I've got technicians giving me, and these are technician leaders, giving me input on the direction that they want this program to go for their profession. So this isn't just me saying, here's what I think veterinary technology needs. This is veterinary technologists saying, here's what we need. So those are the things I think I'm most proud of.
That's awesome. Bonnie Price, thanks for sharing. Thanks for answering some questions.
Yeah, Todd, I'll be, actually have a booth. I have a table at the conference. So I'll be at AVTE. I got a table. I have really, really cute ink pens. You're going to want to come and get one. But if you have any questions, come by and chat, and we can talk more about the program there too.
Sounds good. Last question that just popped. Would this qualify a tech to teach at a 4-year college?
So I think it will. We have actually one of the technicians at LMU is going to be doing it this fall. She's going to be taking it full time. And she is right now I think her title is, I think she's the animal care supervisor. We have had in the past one technician that we were able to hire as faculty. And the way we worked around that for her was she had a master's degree. It was a master's in business administration, I think. But then she took an additional 18-hour certificate in a veterinary specific area. So I think she ended up doing, it might have been that like certificate that it was either one that like Louisiana or Florida had like an 18-hour certificate program at the graduate level. So we had to like jump through a bunch of hoops to get her to do it, but we were able to get approval to hire her as faculty. So that's the only one we had. So I'm thinking that this degree can do it. So I will let you know as soon as our technician here finishes and we get like, check the box. But that's another big goal of mine is I want a way that we can get text, teaching text and tech programs around the country too. And give them the opportunity to be faculty, right? So this individual, got it. If she made it from staff to faculty, I mean, this program would pay for itself in 2 years or less. So the total program cost is around $20,000, so $650 a credit hour.
Cool. And where should folks go if they want to learn more besides emailing you directly?
Email me directly. We have a website, but I've got more information than the website right now. Come see me at the AVTE. Connect with me on LinkedIn. We're going to be starting to post program updates there too. So if you want to follow along.
And if you want to have some real fun, if you go visit Bonnie at AVTE and you remind her that you were on this webinar, she's going to take down your name. She doesn't even know she's doing this. She's going to take down your name and I'll take care of your membership for the next year. Go see her. We'll make it worth your while.
Awesome. I will do it.
This is just what happens. I come up with things and Bonnie might have to remind me at AVTE about this conversation, but we always make it work and play it out. But friends, wonderful time. Thanks for joining us. This tape will be put out and shared, and hope to see you in a couple weeks, and have a great rest of your Wednesday.